Hello everyone, I am Dr. Rucha Mehta, consultant endocrinologist and diabetologist working at Edmo Clinic and Apollo Hospital, CVHF in Ahmedabad. And I am very glad to be here today at DIACONE conference in Ahmedabad, wherein we will have a lot of scientific highlights on the cutting edges in diabetes and diabetes treatment. So one such topic that I will be speaking on today is something that is very near and dear to my heart. So for ages we have known that type 2 diabetes is mainly linked to weight gain, obesity. We do say that diabetes runs in the family and this could be a genetic diabetes, but there is good news for all of us that if we can change the way we behave, we can change our lifestyle, there is a possibility that we can prevent diabetes, we can also prevent or reverse diabetes if you already have it. Now, how do we go about this? In today's debate, I will be speaking against my worthy opponent on lifestyle changes management as the primary target for treating type 2 diabetes versus taking medications alone and only focusing on glucose control. So what sounds better to you? I would say weight management, which can not only help you to reduce the number of medications that you're on for your diabetes, but also can impact many other cardiometabolic markers such as heart disease, blood pressure, cholesterol, fatty liver, and in the long term reduce mortality. So I think we have a one-step approach, which is a more holistic approach for our patients. Now, how do you go about doing this? We know from the results of several good studies now, and one such trial is the DIRECT trial, which was conducted in about 300 patients with type 2 diabetes. And what we found that in a primary care-based setup, a simple intervention, which was just a dietary intervention, allowed patients who lost more than 15 kilograms at the end of 2 years to achieve reversal of their diabetes. So this is great news. As a clinician, even if I can get 5 or 10% of my patients to reverse their diabetes, that's fantastic. And the remaining patients who did not reverse diabetes saw a dramatic reduction in the number of medications they are on. We also now have several new medicines in diabetes which can help with the same. So I urge all of you to listen to the talk. We have data available for you to read, and I urge you to consider lifestyle management as the primary treatment for your patients with type 2 diabetes. Do not simply resort to medications. This will be a more viable approach in the long term. Not only is it green, not only is it sustainable, but I see no side effects to lifestyle therapy. So thank you very much for listening to me, and again I welcome you to DIACONE Ahmedabad.